Let's say there's a hospital, 500-bed hospital in a big city, and they have 700 falls per every year, 700 falls. You're talking about a cost impact of those falls being $7 million for one facility. In the U.S., overall, the literature clearly shows that there's a lot of work being done for fall prevention. And that number is about $5.6 billion that U.S. hospitals have spent nearly $5.6 billion annually to reduce falls. And that means, different things. They could be doing bed alarms, chair alarms, sitter utilization, patient education, nursing education. So they're trying really hard, and they're throwing a lot of money at this because it's such a big cost to these hospitals and all these falls that are occurring. The patients that fall with a serious injury or moderate to serious injury, there's literature and evidence out there to support that could increase the length of stay by up to 4 to 6 days. So you're talking about extending that length of stay 4 or 6 days, the cost associated with that care for 4 or 6 days, but then you've also got the inability to have a new patient in that room generating new revenue. So that ties up that opportunity to turn that room and generate new revenue because that patient's staying longer. And you've got patient satisfaction, patient scores, you've got institution reputation, you've got an increased risk of litigation and lawsuits because of the falls. You've got increased sitter hours. I would say that when I talk to CNOs around the country and around the state of Ohio, the biggest problem I hear about all the time is just the increased use of sitters. So people are hiring more people to bring in there to sit with the patients to try to avoid the falls. And then, of course, that's increasing their salaries and their FTE expenses because it's very expensive to have all these sitters in here sitting in people's rooms. Who's at risk is obviously the elderly population. And if you look at whether you're in the hospital, outside of the hospital, falls are a major problem for the elderly population. Now you bring that elderly population into the hospital. That's an unfamiliar setting. They're on medications. They're in a lot of pain. They're in some kind of acute medical situation. So falls are a problem outside of the hospitals with just the elderly. Now you bring them into the hospital in these conditions. They're unfamiliar, lots of medications, IV pumps, different things going, catheters in place. So you just really increase the risk of a fall in the elderly population when they come into the hospital.